With so many remarks now being made in the United States on paracetamol or Tylenol and whether it actually has an impact or related to autism or ADHD, we thought we'd get a straight answer. Joining us now, Dr. Soumya Swaminathan. Thanks, ma'am, very much for being with us. You've been a chief scientist of the World Health Organization. You know a thing or two about drugs and basic ones like this. I think the basic question that a lot of people in our country want to know is, whenever we are unwell, we have a fever or a headache, we have a crocin or, a Calpol or a Dolo. Is that harmful?
It's not harmful, Vishnu. Let me say that, first of all, for any medicine that we take, we always have to balance the benefits and the risks, right? So when we take a medicine, it's for a symptom or a disease that we're suffering from. And every medicine has always some risks, some chances of side effects, however small they may be. So paracetamol is one of the safest medicines. It's used to treat fever. It's an anti-inflammatory. It's also used as a painkiller. And it's been used widely for many, many, many years across all age groups. In pregnancy, in fact, is one of the safest drugs to use for either pain or fever. There is no need to panic. There is no, I would say, no new dramatic news or scientific evidence that should make us get alarmed or take pause at taking paracetamol. So when we need paracetamol, we can certainly take it.
So, ma'am, I think the question, therefore, is what the Americans have been saying, what President Trump and what his medical advisors have been saying, is that in the case of pregnant women, if they are to take Tylenol, then there is an increased likelihood of autism for the child, for the fetus, and perhaps ADHD in later life. Is there any scientific evidence of this that you trust?
So, if you look at studies that have been done, of course, autism is something that we still don't know the cause of. And so there is need for more research on autism and related disorders. And it's very important to actually fund that kind of work. But the studies that have been done are mainly observational studies. So you follow up a lot of pregnant women and or you go backwards looking at children with autism spectrum disorder and see what happened during pregnancy. And what these studies have shown are basically that there is some association, a weak association between taking paracetamol during pregnancy, especially late pregnancy, and having some kind of neurodevelopmental disorder. Now, it's also correlated with the length of time and the dose of the drug. So the longer you've taken it for, the higher the total amount of the paracetamol, a little bit the association gets stronger, because overall it's a very weak association. There's a difference between association and causation, because there are so many factors, what we call confounding factors or variables. For example, the very condition for which the woman might have taken paracetamol. It may have been an infectious disease. It may have been an inflammatory disease that she was suffering from. Now, that could have been the reason why that particular baby had a particular outcome. It may not have been the drug at all. So when studies have been done on siblings, so the same mother, the same environment, the same genetic background, then these associations actually kind of become very little, or they disappear almost, indicating that there are other influences that are probably much more important than this drug. So I think it's a bit of an overreaction now, what is happening in the United States, creating unnecessary fear and panic among people. This is not to say that we should medicate ourselves or over-medicate or self-medicate. I think that just common sense tells us that we should take drugs only when we need to, for the right dose, for the right duration, on a doctor's advice. And particularly if someone's pregnant, you don't want to take unnecessary medication, because no medication is 100% safe. But having said that, if you have a fever or pain or any other condition for which you need relief, you can take paracetamol. It's extremely safe. It's the safest painkiller you can take during pregnancy.
And therefore, ma'am, the larger question, because we've seen the Trump administration come up with a lot of statements of late, which, are questionable. For example, the entire issue of vaccines. They have anti-vaxxers running the medical program. And now remarks like this. Is this hocus pocus science?
I think it's extremely dangerous and extremely damaging, because we're talking about public health here, and we're talking about creating distrust amongst people in science, in medical advances. Vaccines have saved millions and millions of lives. We've eradicated diseases like smallpox because of vaccine. We're on the verge of eradicating polio. This would not have been possible without vaccines. And similarly, for many other benefits that have been proven through years and years of medical research, including, casting doubt on mRNA vaccines. mRNA technology is a technology that's going to provide us a lot of benefits in the future. There's a lot of research going on, not just on COVID vaccine, but on a whole range of monoclonal antibodies, therapeutics, and vaccines. So I'm, absolutely, it's horrifying to see that the kind of attacks on science, and particularly on health and medicine and medical research that are now that you see, will have a damaging effect on the health of people around the world, because when you sow that little seed of doubt, the next time your doctor or a public health practitioner tells you something, you begin to suspect it.
Yeah.
So while it's good to question and to understand the reasons and the rationale behind certain decisions, it's a completely different thing to be spreading misinformation.
Do you believe there needs to be, and this is my final question, a categorical statement from the ICMR telling people that, paracetamol, if taken in proper doses, is safe?
So regulatory agencies around the world, including the European and the Medical Health Research Agency of the UK, have already put out statements reassuring the public that paracetamol is safe during pregnancy. I'm sure that the Indian authorities would do so also very soon.
All right, ma'am. Thank you very much for speaking to us. I really appreciate it. Thank you.
Thank you.